Greetings, we are from SGDB4, are going to present our student project. Next. Here's the members of SGDB4. Next. Okay, first of all, let me introduce myself. My name is Naomi Margaret Ber Panjaitan, and my last digit of student number is 167. This is the clinical scenario that we use in our student project. Next. Okay, the introduction. Asthma is a chronic disease. It's a condition caused by inflammation and tightening of the muscles around the airways, so that the airways become narrower and makes breathing become more difficult. Asthma is the most common chronic disease in children. That's all from me. The next slide will be presented by my friends. Thank you.
Hello, my name is Kudira Kasuta Samudra, number 023. I will explain you about bronchial asthma, is the most frequent chronic condition. Using systemic corticosteroids, SAs, to treat acute asthma exacerbation is useful. Admission rates were reduced by 60% when SE was given within an hour of an exacerbation. Using ICS or inhaled corticosteroids instead of oral prednisolone has been shown to have several benefits, such as a higher likelihood of being released from the emergency room in less than 2 hours. According to the 2018 Global Initiative for Asthma report, children's asthma exacerbations may benefit from the use of ICS. On the other hand, ICS for asthma exacerbation is not included in the Japanese recommendations for pediatric asthma. It is still unclear whether children receiving systemic corticosteroids or inhaled corticosteroids will experience acute asthma. Therefore, the author needs to make a critical appraisal based on evidence-based medicine to determine the most appropriate treatment to use in children with bronchial asthma. That's all from me. Thank you.
My name is Madikina Devisa with last digit number 197, and I would like to explain the question formulating using PICO. So based on the scenario, the type of clinical question is therapy or intervention. The following is formulation of clinical research question using the PICO framework. The patient or population is patient with acute asthma exacerbation, and then intervention is methylprednisolone and betamethasone, and the comparison is budesonide and prednisone. So that's all for me, and the presentation will be continued with my friends. Thank you.
Hello, my name is Mira Amba Grace Fricha, and the last 3 digits of my student ID number are 018. I will continue to talk about the outcome and the clinical research questions. So for the outcome is the effectiveness of the use of systemic corticosteroids in reducing the severity of asthma exacerbations, reducing hospitalization rates, and improving respiratory function with acute asthma exacerbations in the emergency unit or the ER. The clinical research question is, in pediatric patients with acute asthma exacerbations, does early administration of systemic corticosteroids compared to inhaled corticosteroids improve patient outcomes? That is all from me, and the presentation will be continued by my friend. Thank you.
Hello, my name is Imade Bintang Dila Sofitari. With my last 3-digit student ID number is 157. Here I'm going to continue to explain about the next chapter, journal search. Based on the research question that has been made and the PICO formulation, we searched by using Google Scholar Advanced Search. Through this search, we found 5,270 articles in the last 5 years about study of systemic corticosteroids or inhaled corticosteroids for acute exacerbation of asthma in children. The next article search is by randomized controlled trial filter in last 5 years. From this filter, we found around 1,690 results of articles. And then we choose the article named Comparison of Nebulized versus Systemic Corticosteroids for Management of Children Presenting with Acute Exacerbation of Asthma for further critical appraisal. That's all for me. Thank you.
My name is Gide Boy Bramantara with my last 3 digit of student ID number 8047. Next, we're going to explain about the quality of this study. Mostly we're going to explain about the design and method used in the study. So the study was a parallel study, single blind, with 60 children. The group is 30 with 20 males and 10 females with controlled age. But when the demonstration method was stated, so we think this study is quasi-experimental study. Inclusion criteria, children with at least mild symptoms of acute asthma observation. Exclusion criteria, they can inhale corticosteroid daily for the past 3 months. Common, sevoflurane, anti-leukotriene, antihistamine drugs, and systemic corticosteroid negotiated demand. Group 1 intervention was nebulized corticosteroid. In other hand, Group 2 was systemic corticosteroid. Each group has the same assessment or scoring method to assess post-intervention.
Hello everyone, my name is Natasha Repusparani with a 3-digit number of 227, and here I'll be continuing the presentation for validity of our study. So for the intervention of this study, the first group was given nebulized flunisolid at a dosage of 20 micrograms per kilogram twice per day for 1 week, followed by every other day for the following week. Meanwhile, the second group was given systemic budesonide at a dosage of 0.5 milligrams twice daily for 1 week, followed by 0.25 milligrams for the following week. Both groups received inhaled salbutamol at a dose of 200 micrograms 4 times a day for the first 3 days, followed by every other day if needed. The nebulizer used was an air jet nebulizer. In addition, the children's parents were given education on how to use them. After the 2-week treatment, both groups were assessed for follow-up by using oscillometric resistances. It had been mentioned in the study that it was conducted using a single blind method. There were no dropouts reported in this study. Overall, the researchers of the study had not specified how the 60 children were divided into both groups, and randomization was not mentioned. However, there was a proper control on the intervention by the specific medication type, the dosage, and how it was administered on both groups. Afterwards, the follow-up method and time was mentioned in the study. The measurements were also done with a single blind method. That is all from me. Next will be continued by my friends.
Good morning, everyone. My name is Natasha Pratyadevi with 3-digit number 056. Now I'll explain the important aspect of the study that we use in our student project. So this study compared the use of steroids that were administered systemic or by using nebulizer between 2 groups. Both groups have similar characteristics where there was a family history of allergies at 60% and the age mean was within the range of 5.8 plus minus 7.45. Although there are differences in the amount of gender, where the number of boys was bigger than the girls. By using oscillometric resistance, reduction in disease severity was found higher in group 1 that used nebulized steroids compared to group 2 that used systemic steroids. The result from this study showed that nebulized flunisolid improved acute asthma symptoms more quickly than budesonide used as systemic steroid. In fact, in the first 7 days of therapy, oscillometric resistance and symptom ratings decreased more quickly in group 1 that used nebulized flunisolid than in group 2 that using systemic budesonide. The therapeutic impact of 2 medications remained even after the dosage was reduced by half, with no increase in airway resistance. That's all from me. Thank you.
Hello, my name is Lovina Saraswati with the last 3 digits of student ID number 142. Now I will continue about the aspect of importance. So based on the mean duration of hospitalization, it was found that group 1 using nebulized steroids was 1.5 plus minus 3.14 days compared to group 2 using systemic steroids 2.8 plus minus 9.31 days. The level of satisfaction from the mother of Group 1 patients was greater with 27 people compared to the Group 2 with 24 people. So based on the aspect of importance, it can be said that this journal is important to assess nebulized steroids and systemic steroid therapy in terms of clinical and duration of hospitalization stay. Based on the result obtained, Group 1, which is given nebulized steroids, can reduce severity and shorten the length of stay in the hospital compared to systemic steroids. That's all from me. The presentation will be continued by my friend. Thank you.
Hello, my name is Nadia Zalfa Kila with the last 3 digit number 079, and I would like to deliver the first part of the applicability. So the evidence from a simple blind study of Giuliani show that inhaled corticosteroid or nebulized steroid is more effective in treating acute exacerbation of asthma more than systemic corticosteroid. And this study that there is 60 children with acute exacerbation of asthma is divided into 2 groups with the result Group 1 show a greater reduction in disease severity by using oscillometric resistance, and according to the study, nebulized flunisonide reduced acute asthma symptoms faster than systemic steroid budesonide. Indeed, oscillosemitic resistance and symptoms rating also decreased more quickly in Group 1 rather than in Group 2 during the first 7 days of therapy. That's all. Thank you.
Greetings, my name is Nikomang Ayu Amanda Stirijaya with my last digit number 037. I would like to continue the presentations about the applicability of these critical appraisals. In studies that compared nebulized with systemic corticosteroids for children management, found that nebulized flunisolide improved acute asthma symptoms more quickly than budesonide used as a systemic steroid, even after cutting the dosage in half as recommended by the GINA guidelines. The two drugs' therapeutic effects persisted and there was no rise in airway resistance. Numerous studies have demonstrated that ICS not only reduces the incidence of hospitalizations for asthma, but also improve clinical scores, lung function tests, particularly FEV115, lowers the need for bronchodilators, and shorten hospital stays. Some disadvantages of utilizing ICS include increased prices, restricted availability in developing nations, and lower efficacy in individuals with a high respiratory rate. Therefore, further analysis will be needed, in which, in this case, we will like to use the cost effectiveness plane analysis, or CEP. Based on the explanations above, it can be seen that ICS has better effectiveness but requires increased cost to implement it. Therefore, this therapy will enter quadrant 1 since the interventions is more effective but more costly. That is all from me. Thank you.
Hello everyone, my name is Valencia Panjaro Solubis with the last 3 digits of my student ID number 113. So I'm going to conclude about the student project that has reviewed by our student group discussion. So in terms of lowering the severity of the condition and length of hospital stay, our study's findings indicate that nebulized steroids are helpful and effective treatment option for acute exacerbation asthma when compared to systemic steroids. That's all from me. Thank you.
Here are some of the references that we used. Thank you very much for your time and attention, and we apologize for any mistakes.